We have a whole wide range of surgeries that come in through our doors at CSSM, and these stem from your tendon repairs involving your shoulder and your Achilles, all the way through to your arthroscopic keyhole surgeries, to your larger scale operations like your total joint replacements. In all hospitals now, even something as traumatic as a joint replacement surgery, if your anaesthetic's worn off by that night, if you've had surgery that morning, you're up that day, you're standing. So there's been a massive shift in the research to promote early interventions and what we call early mobilisations. It's basically get you moving as soon as possible. Keep the knee nice and straight, point the toes down towards the floor, and again we've got the calf muscle here working to build some strength to get you back running. Initially it's all about regaining that connection from the brain to the muscle in what we call sort of neuromuscular control or muscle activation. So that's very key or very important post-operatively, at least in the early stages. But then we move on to so your bigger, more robust movements where you're using it more functionally in terms of your squat movements, pressing with your legs out or coming up onto your toes, in a bit of a calf raise, all designed to get you moving how you were. So back up on 2 feet. Across to the right hand side and down with one. Perfect. Weeks, maybe months down the track where we start to incorporate our explosive stuff and our return to sport movement patterns. If you have a stronger leg before surgery, then your outcomes post surgery are going to be enhanced, and the data supports that. There's so much new research coming out now that's indicating or that's showing how effective preoperative physiotherapy is, and not just prior to surgery, but also affecting long-term outcomes. By the time someone comes and sees us here in the clinic, there's usually been a couple of weeks post-op or post-surgery that they're coming in to see us. So there's things they can do within that 2 weeks once they leave the hospital. A huge goal of mine, and I explain this to most of my clients, is it's not just returning you back to where you were. We want to get you back better than what you were when you came in here, because it's the level you're at prior that you got yourself injured. So we want to get you to 110 or 120, 150% even, to then make you stronger, more robust and more resilient to particular injuries.